How's it, and welcome back to my channel. Today we will be doing the recovery position. We will be continuing with the format approach, which is why, what, how, and if. If you want to learn how to potentially help someone who's had a seizure, someone who has collapsed and they are unconscious by breathing, or maybe they've taken a drug overdose and now they're unable to talk or unable to communicate with you, how would you save a life? Genuinely save a life. Why the recovery position? So it is designed to help someone who is unconscious, so that if they vomit or if they are struggling to breathe and their tongue falls back into the airway, they will still be able to breathe. It is to benefit people who aren't necessarily fully trained in how to manage an airway, but they still want to do something. It is there for just so many reasons. It can save a life because it's easier to do, it's quick, it's safe, and it is very effective. So what is the recovery position? So the recovery position is when you put someone onto their side. And what this does is that it means that when they breathe, the tongue doesn't fall back into the airway, and if they vomit, the vomit comes out. And so in a way, you are making sure that their airway is patent and open. It will help someone who is unconscious if they've had a drug overdose, if they've had a seizure, if they've just fallen unconscious, if they've had a stroke, if they've had all these things happen to them and they are now not able to talk to you, but they're still breathing and have a pulse, put them into the recovery position. So how to do the recovery position? What you do is the patient is lying on their back, which is what we don't want. You will put them onto their side. So like you would be sleeping in a bed, you put their hand behind their head, you put their one leg, or you put their right leg over their left leg, and you'd roll them so that they're lying on their arm and their right leg is in front of them. Or the other way around, their left leg is in front of them or their right arm is behind their head. So what this does is that so that when you leave them and you let go of them, they will remain on their side. So if they were to vomit, the vomit would come out and you can hear them breathing. So those are important things to check, so that if they do start to vomit, make sure that they stay on their side, and that if they are breathing, just make sure that they're still breathing when they're on their side. And that's kind of the purpose of that. So if you come across someone who's unconscious, if you come across someone who's had a seizure or a stroke or whatever's happened and you don't know what's happening, you approach them with remember, hazards, hello, help. You say hazards, it's clear, hello, they're not responding, you call for help. You see that they are breathing or they're trying to breathe. A really good way, and what you really should be doing, is put them on their side. Put their hand under their head, put their one leg in front of them so that when they roll, they don't roll onto their stomach. And that will be effectively opening their airway and protecting their airway. So you are protecting it from vomit, because if they vomit and they breathe in, they vomit, it's critical. And then if you have them on their side, they will be able to breathe clearly without their tongue falling back into their throat. And yes, you can choke on your tongue. You definitely can. So this is story time. In our studies, we learn about the recovery position, and you think it's really cool, but you don't really realize how much you're going to use it. And then when you become a paramedic, you realize that every patient who is unconscious and breathing goes on their side. And that's more common than you think it is. It is also something that can really save a life, especially if you have more than one patient. If you have 2 or 3 patients and you can't be with them all, you put them on their sides. So if they vomit, they don't choke, and they also don't obstruct their airway with their tongue. I've had many a patient who I've gotten to them and they're unconscious, and I don't know why they're unconscious. They're breathing really well, they've got really good blood pressures, there's nothing really wrong with them besides the fact that they're unconscious. I will put them on their side and I'll take them to hospital. There's really not more that needs to be done in that moment to save his or her life than to put them on their side so that they can breathe, so that if they vomit, they're not going to choke on their vomit. And those are the main reasons and purposes for the recovery position.